SDHER, Sri Rajendra J, Vice President, SDUET, Dr. Develan Prasad Sir, Chief Administrative Officer, SDHER, Dr. B. Vengama Ma'am, Vice Chancellor, SDHER, Dr. Muninarayan Sir, Registrar, SDHER, Dr. Prabhakar K, Principal and Dean Faculty of Medicine, Dr. Vinita Shankar, Dr. Vishwas onto the dais. Inspiration. To set the tone for today's sessions, we will start with an invocation song by Mr. Bhavya Mitra and Mr. Arival.
Ramachandra Kripal Bhajaman Haran Bhav Bhaya Darunam Nav Kanjalocana Kanja Mukhakar Kanja Pad Kanjarunam Kandarpa Ganit Amit Chavi Navneet Nirada Sundaram पटपीतमानो तडितरुचि शुचिनोमि जनकसुतावरं भजो दीनबन्धु दिनेश दानव दैत्यवंशनिकन्दनं रघुनन्द आनन्द कन्द कौशल चन्द दशरथ नन्दनम् गलभोजंग भस्म अंग गलभोजंग भस्म अंग शंकर अनुरागी गलभोजंग भस्म अंग कर अनुरागी गल भुजंग भस्म अंग.
I, Dr. Ashwini, Organizing Chairperson of Demedcon 2024, extend a warm welcome to each one of you for the conference, a platform where the bright minds in the field of medicine has come together to share knowledge, ideas and innovation. The theme of this year's Demedcon draws inspiration from space exploration, a symbol of discovery, collaboration and endless possibilities. At the outset, I would like to invite and welcome our dignitaries on the stage. I would like to introduce our esteemed Chancellor of SDHER, Sri T.H. Nagaraja Sir, whose leadership and vision continue to inspire and guide this great institution. Welcome you, sir, to the program. I welcome Sri Rajendra J, Vice President of the Trust. Sir has been instrumental for the development of our institution. We welcome you, sir, to Demedcon 2024. I welcome Develan Prasad Sir, Chief Coordinating Officer, who plays an integral and major role in administrative activities of our academy. Welcome you, sir, to the event. I welcome Dr. Vengama Ma'am, Vice Chancellor of our Academy, who always is committed to academic health and patient care. I welcome you, ma'am, to the event. I welcome our Registrar, Muninarayan Sir, whose efforts ensure the smooth functioning of this university, allowing us to continue growing. Welcome you, sir. I also welcome our Principal, Dr. Prabhakar. Guidance the institution continues to nurture professionals and whose support and leadership has helped us drive Demedcon 2024 forward. We welcome you, sir. I also extend a warm welcome to Dr. Vinita Shankar, Vice Principal of our college. I also welcome Dr. Vishwas, Organizing Chairperson of Demedcon 2024. I extend a warm welcome to Dr. Radhakrishnan Sir, our Chief Guest, and Dr. V.V. Pillai Sir to the event. I extend my warm welcome to all the delegates, including the undergraduate students here, interns, faculty members, heads of departments, for being part of this event and for their enthusiastic participation. I also extend my special thanks to our guest speakers of the workshops of today, and also special mention to our sponsors, engineering section, estate section, food transport section, who have helped us bring this event to life and ensure reach far beyond. The presence of our dignitaries has really exemplified the spirit of the conference today. We welcome you all again to Demedcon 2024 I hope all of you enjoy the journey of Demedcon for day 2 and day 3 ahead. It gives me immense pleasure to move on to moments of today, the felicitation of our esteemed chief guest, Dr. Radhakrishnan sir, a distinguished surgeon, and Dr. V.V. Pillai sir, Chief of Poison Control Center, Professor and HOD Department of Forensic Medicine. For that, I request our principal sir to introduce these two speakers to the audience.
As all of you know, the Demedcon designed to bridge the gap between the classroom knowledge and the real world demands of the healthcare. It is an opportunity for you to learn from leading experts, explore the innovative clinical skills and enhance your understanding of the various career paths that lie ahead of you. The main purpose of this particular conference is to gain insights into topics that are not always covered in the lectures, such as emerging medical technologies, patient-centered care and health policies. And it also engages in workshops and hands-on sections that teach practical skills and also helps you to understand how to work as part of multidisciplinary teams and critical skill in today's collaborative healthcare environment. I hope that you enjoyed all the sections yesterday, both plenary as well as workshops. And also I came to know that today morning the workshops engaged with subject experts were thoroughly enjoyed by all the stakeholders concerned. And I thank all the subject experts and also resource persons for imparting their important knowledge to the delegates who attended this conference. And yesterday we had the inaugural function, but the very purpose of having this today's particular small function being to felicitate one of the two important luminaries in their respective fields. One is Professor Dr. N. Radhakrishnan and Dr. V.V. Pillai. So I have been asked to introduce the Dr. N. Radhakrishnan, who is a senior consultant vascular surgeon and is an honorary visiting professor, especially in the field of nanoscience and technology, MG University, Kerala. Sir did his both UG PG qualification, that is MBBS and MS, from the Government Medical College, Trivandrum, University of Kerala. And Sir has got several accomplishments, including FRCS London, Glasgow, FACS USA and Canada, FACS from that is in the phlebolymphaology, FAMS and FAS. And Sir is also a member of Royal College of Physicians, American College of Phlebotomy, member of American Venous Forum, member of European Venous Forum, and so on and so forth. The presently Sir is a medical director at St. Thomas Institute of Research on Venous Diseases, medical administrator since 2013 and senior consultant vascular surgeon at St. Thomas Hospital. And Sir is the chairman of Ethical Committee of National Homeopathy Research in Mental Health. And Sir is also chairman of Dr. N. Radhakrishnan International Center for Medical Innovations, Mahatma Gandhi University, Kerala, since 2023. Sir has also got a lot of academical credits to his, he's got a lot of presentations like in IACS Council, a topic being a novel perspective on management of venous diseases. And Sir has got so many awards, both national and international. To name a few, he's been awarded the Best Doctor Award 2023 by Mangalam on 22nd July 23 at Changanasari, Kottayam, Kerala. Medical Innovation Award in 2023, Best Malayali 2019, Mother Teresa Award, Government of Kerala nominated for Padma Awards for 2019, Best Doctor Award 2017 by Kerala People TV, and Bharat Jyoti Award at New Delhi, the Pride of India Award again at New Delhi, Gold Medal for Excellence, Indira Gandhi Sadbhavana Award, Rajiv Gandhi Shiromani Award, and to the international awards include Lifetime Achievement Award. The award was presented by the former President of India, Her Excellency Srimati Pratibha Dev Singh Patil on 19th of 2014. Global Indian of the Year Award 2014. International Gold Star Millennium Award, which is presented by former Deputy Prime Minister of Thailand, Mr. Korn, on 27th 2013 at Bangkok. And Sir has got social commitments also. Like he is the chief patron for Sukritam and MP chief of Rotary International and is also served for rehabilitation of street children at Sneha Nivas, indoor play station for physically challenged girls at Mercy Home, Kerala, emergency relief activities for tsunami, diabetes awareness classes for public organized by Mary Ravani Public School, and the varicose vein awareness class, so on and so forth. I think it goes endless. We are very happy and we are very privileged to be having you, sir, here in this function. Welcome for this small event, sir. Thank you, sir. And I also have privilege to introduce Dr. P.V. Pillai. Sir is the Chief of Poison Control Center and Head of Analytical Toxicology and Professor of the Department of Forensic Medicine and Toxicology at Amrita Institute of Medical Sciences. And Sir did his graduation, post-graduation from the Gandhi Medical College, Hyderabad. And he has got more than 100 publications in national and international scientific journals. And Sir, being author and editor of several books, and he's contributed to the section on toxicology in Oxford Textbook of Medicine, AP Textbook of Medicine, and Textbook of Emergency and Trauma Center, and Tandon's Textbook of Cardiology. Sir is also editor of Journal of Indian Society of Toxicology, and Sir is a referee on toxicology for Journal of Association of Physicians of India, and he has contributed to several monograms on analytical toxicology for World Health Organization. Sir is an external reviewer for the new edition of Guidelines for Poison Control published by WHO, and is a member of working group member for WHO Guidelines for Poison Control Network, Edinburgh, UK, founded the Indian Society of Toxicology 2004, recipient of Society of Toxicology USA Award at 57th annual meeting in San Antonio, Texas. Sir conferred Lifetime Achievement Award for contribution to the medical toxicology in India, and conferred Fellow of Indian Academy of Forensic Medicine at 43rd Annual National Conference of the Indian Academy of Forensic Medicine. And Sir is also featured as expert on toxicology for several online programs and OTT platforms, including Netflix. And we are very thankful to you, sir, for gracing this occasion. Thank you.
Thank you, sir, for introducing our guests to the audience. I now request our dignitaries to felicitate our chief guests, Dr. Radhakrishnan sir and Dr. V.V. Pillai sir.
So, one and all present over here. Sri Devarajaras Medical College, Constituent Unit of Sri Devarajaras Academy of Higher Education and Research. They are organizing 6th National Undergraduate Medical Conference, Demedcon. Dignitaries on the dais, dignitaries of the dais, our University Chancellor, Mr. G.H. Nagaraja, Vice Chancellor, Srimati Vengamma, today's chief guests, Radhakrishna Pillai, and Radhakrishna, one more guest of honor, Dr. V.V. Pillai, principal of this prestigious college, Dr. Prabhakar, and all the organizers who are responsible for this medical conference, who have supported this medical conference directly and indirectly, and very important, the participants for this conference who have come across the country. So this Demedcon medical conference, first of all I would like to wish each one of you to participate in this conference. Management of this university is always supporting medical conferences, international conferences and research activities to enrich the knowledge of medical in the medical ground in the students. So I hope this medical conference will be a great success and it will be a bottleneck for your future medical career. So once again, I would like to wish all the best from my management side. Thank you very much.
Thank you, sir, for the encouraging and inspiring words. We now move on to the Day 1 report of Demedcon 2024. I am delighted to present you all to Day 1 report of Demedcon. We had an inspiring plenary session by Dr. R.K. Prasad sir on Day 1, who is a family physician and president of AFPI Karnataka, on decoding the patient journey, the making of an exemplary physician. Sir emphasized the importance of clinical practice, insights, context of undergraduate medical education and patient care strategies. We also had an enlightening plenary session by Dr. Geeta Jotwani ma'am. In her session on research capacity building, ma'am focused on the importance of developing research skills among medical professionals. She discussed various ICMR proposals and funds, strategies for enhancing research infrastructure, mentoring young researchers and fostering a culture of inquiry in medical institutions for advancing healthcare and medical education. We also had an inspiring plenary session by Dr. Sharan Srinivasan sir titled Rebooting the Brain, a Journey with Guitar Surgeon. Sir's session was an insightful exploration into the intersection of neurosurgery and innovative treatments for brain disorders. Sir shared experiences in treating conditions like epilepsy, tremors, Parkinson's using deep brain stimulation. The session also delved into his personal journey and passion for neurosurgery. Sir also has authored various books on neurosurgery and stalls have been placed for display. Moving on to the report on scientific sessions Demedcon 2024. The scientific session on Day 1 at Demedcon 2024 were a testament to the academic rigor and enthusiasm of undergraduate medical students across the country. Day 1 witnessed a vibrant exchange of ideas through 11 oral presentations and 13 poster presentations. Total, we had 24 presentations showcasing innovative research and critical thinking. We have kept prize money for these events. Key highlights of oral presentations included public health studies and epidemiological studies and innovations. The interactive nature of the poster session allowed attendees to engage ideas and spark ideas and opportunities. So we also witnessed art and medicine, debate, escape room, social nights, which were the other events for Day 1. We also had a brief report of souvenir presented during the inauguration. The souvenir release at Demedcon 2024 marked a significant moment in the event, celebrating the hard work and dedication that went into organizing this National Undergraduate Medical Conference. This souvenir was a reflection of our Demedcon 2024. May I request Samprita to play the video? We'll play it again. So we move on to the day 2 events. So day 2, the registration was open at 8 and 9 to 12 am we had workshops on basic surgical skills, GI endoscopies, ECG made easy, cardio care, cognition, research methodology, triage in emergencies and pediatric emergency, technologies in diabetes mellitus management, analytical toxicology, radiology simplified, and ENT made easy. So evenings we have spell. Then we also have a plenary session by Dr. Somu Shivabalan, Dr. Janani Muralidharan, followed by valedictory functions. So these are the event reports for yesterday's and then day 2 and day 3 planning. We move on to the prize distribution of certificates to our guest speakers. So for that, I request our dignitaries, our President and Vice President, sir, to hand over the certificate and memento of appreciation to our guest speakers of workshops. May I request Dr. Yashwant, sir, Consultant Cardiologist, Narayana Health Center, Kola, to come onto the dais. I request our President and Vice President, sir, to honor I request Dr. Shivkumar Shamrao, sir, Consultant Pediatric ICU, Manipal Hospitals, Bangalore, to come on to the dais. Director of Cardiology. May I request Dr. Ramesh T.S., Consultant Medical Access Surgery, Manipal Hospital, Bangalore, to come on to the dais. I request the dignitaries to do the honors to our guest speaker, Dr. Ramesh T.S., Consultant Medical Access Surgery, Manipal Hospital. I call upon Dr. Sushma, Consultant Psychiatrist at St. Philomena's Hospital, Bangalore, onto the dais. Request our dignitaries to do the honors to Dr. Sushma N. Dr. Krishnamurthy, Assistant Professor, Department of Emergency Medicine, SDMC, Kolar. I request her to come onto the dais and give the certificate of appreciation to Dr. Krishnamurthy, sir. I request Dr. Kamrao Zamal, Scientist EICMR NITM Belgavi, to come onto the dais, and Dr. Ravi Shankar, Rajesh K, Associate Professor, Department of Emergency Medicine, SDMC. I request Dr. Shivkumar Shamrao sir, Consultant Pediatric Intensive Care Unit, Manipal Hospitals, to come on to the dais. Dr. Shivkumar Shamrao sir. I request our dignitaries to do the honors. Dr. Rajesh K, Associate Professor from Emergency Medicine Department, SKMC. I request our dignitaries to give the certificate of appreciation to Dr. Rajesh K. Efforts that have laid the foundation for making this event a grand success. I also thank our Chief Administrative Officer, our Vice Chancellor, Registrar, Principal and Dean Faculty of Medicine, Vice Principal, Medical Superintendent, Organizing Chairperson Dr. Vishwas S. for the guidance and for the tireless work, meticulous planning and passion that has made Demedcon a truly enriching experience for all of us. Thank you for steering this event with grace and occasion. We are immensely grateful to our chief guest, Dr. R.K. Sir, Radhakrishnan Sir, and Dr. V.V. Pillai Sir for gracing us with your presence today. Your enlightening. We are waiting for your sessions and thank you for being here for this program. A special thanks to our sponsors whose generous contributions have made this event possible, and to all delegates, students and faculty members who have travelled from across India to participate in Demedcon 2024. Thank you for your enthusiasm and active management. Your presence has truly enriched the conference. Finally, to all the volunteers, faculty members and organizing committee members who have worked behind the scenes, thank you for your dedication and hard work. With that, I once again thank each and every one of you for being part of Demedcon 2024. Thank you everyone. We now conclude the event with National Anthem. I request all of you to raise for National Anthem.
नायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल वंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ आशीष मांगे गाये तब जय गाथा जगत भाग्य विधाता जय हे जय हे जय हे जय जय.
May we request Dr. Prakash Dave sir, HOD Surgery of SCMC, to kindly chair the session by the next session by Dr. Radhakrishnan.
Namaste. Esteemed faculty, fellow colleagues, my dear friends. It is indeed a great pleasure and privilege and honor to stand before you today at the Demedcon 24. The fifth National Undergraduate Conference hosted by the prestigious institution chief Devaraj Nurse Medical College. I would like to express my sincere gratitude to the organizers for inviting me to share my experiences and knowledge with such a vibrant and dynamic group of budding doctors.
I had the good fortune of dedicating over 56 years of I was a general surgeon. And good fortune for dedicating for 56 years of my life to the medical profession. I was a general surgeon for 25 years and full-time vascular surgeon for 15 years. I have witnessed an incredible transformation of healthcare and the way we approach disease management. But if there is one lesson I have learned during my life, it is this: in medicine, the journey never ends. The quest for knowledge, the desire to heal, and the need to innovate are ongoing and must remain constant. Today, we are going to talk about innovations in the management of chronic venous disease, a topic that has been the center of my career for over 3 decades. This particular field was seen as a dramatic achievement, but the journey to truly understanding and management venous disease has been long and challenging. For years, the large, dilated, tortuous veins were considered as morbid and targeted for treatment, while the tiny veins were neglected and often referred to as spiral veins or reticular veins, and were considered for cosmetic reasons. Whether in large or small veins is the result of pathological process, and hence it is a disease, not a name. Chronic venous disease, also often occurring near the angle, were believed to be solely the result of large vein deformities, while smaller veins were treated only for cosmetic reasons. However, developments in molecular biology and nanoscience have shaped our approach to these conditions. My team of researchers in genetics revolutionized our understanding of venous disease. We discovered that microcirculatory impediment due to malfunctioning of microscopic veins and valves play a pivotal role in the development of chronic venous disease, and that targeting these structures would revolutionize the treatment. Shifting from tradition to innovation. It is not shocking to know that it took nearly 56 centuries to bring out a new outlook of the disease and to introduce a new surgical procedure accordingly. Instead, there was only modification in the procedures. In medicine, tradition often dominates practice. For a long time, the standard approach to treating venous disease was to target large veins, but innovation often requires challenging these traditions. When we started shifting focus to smaller veins and microscopic vein valves, the results were profound. Not only we were able to offer minimally invasive procedures to patients, but also the outcome improved drastically. We could treat a very large population of nearly 50,000 with excellent long-term results. Our research took an exciting turn when we began to explore the genetic basis of venous disease. Through collaboration with Rajikant Center for Technology, RGCP Trivandrum, we identified the genes responsible for chronic venous disease. This was a breakthrough moment. For the first time, we could explain why certain individuals were more prone to developing venous disease and could tailor treatments based on genetic predispositions. My dear students, as you embark on your own medical journeys, remember that innovation comes from a relentless pursuit of knowledge. You must ask questions, challenge norms, and most importantly, have the courage to explore what has yet not been discovered. Bio-nanotechnology, a known frontier. The world of bio-nanotechnology has opened new possibilities for the management of chronic venous disease. Together with Mahatma Gandhi University, we have been exploring the use of nanoparticles in the to treat chronic venous non-healing ulcers, which are often the result of long-standing venous disease. These ulcers can be debilitating and have a severe impact on a patient's quality of life. Traditional treatments often fail to heal these ulcers, leading to persistent pain and infection. But with bio-nanotechnology, we are developing novel therapies that target these wounds at the cellular level, promoting faster and more effective healing. This represents the exciting intersection of medicine and advanced technology, two fields converging at an unprecedented rate. The future of medicine lies in the intersection of discipline. As the lines between medicine, technology, and genetic blur, you must be prepared to accept and adopt these new tools in your practice. This is why research is so critical. Whether in clinical practice, public health, or basic science, research is the engine that drives innovation. Reaction to innovation by traditional practitioners often vary, particularly in medical fields, where established methods are deeply ingrained and seen as time-tested. The role of compassion in innovation. While I speak a lot about technology and innovation, let me remind you of something even more important, that is compassion. I have seen a surgeon for over 5 decades, and I can tell you from my experience that no amount of technical skill or scientific knowledge can replace the healing power of compassion. Patients are not just cases or specimens. They are human beings with fears, hopes, and emotions. In my career, I've had the privilege of treating over 45,000 patients with CVD, and in each time, it was not just a procedure that mattered. It was the human touch, the smile you offer, the reassurance you give, the way you listen to their concern. These are as much a part of healing process. As doctors, you are not just scientists or technicians, you are healers. Your greatest responsibility is to bring comfort and hope to those in need. Final thoughts for the future generation. As you continue on your path in medicine, remember that innovation and compassion must go hand in hand. You are part of a generation that has access to unprecedented technological advances, but never forget that medicine at its core is about people. My hope is that the work we are doing in the field of chronic venous disease will inspire to explore new ways of thinking about medical problems. As students, you are in a unique position to ask questions and seek answers. You are the future of healthcare and the potential for what you can achieve in life. In conclusion, I leave you with this: innovation is not just for discovering something new. It should be making a difference in the lives of the people. I encourage every one of you to embrace research, question traditional practices, and most importantly, approach your work with empathy and compassion. The world needs not only brilliant doctors, but also compassionate healers. And I have no doubt that many of you will become exactly that. Thank you, and I look forward to engaging with the rest of the time with the presentation. And I salute and pranam to my guru, Professor Dr. M.S. Vijayathan, who was always my mentor and guide. Thank you all. Special thanks to Mr. Deepak Raj, the organizing secretary, for making all arrangements for this session. Thank you.
Alongside the late Padma Bhushan Dr. M.S. Vijayathan, former president of the Indian National Science Academy and National Research Professor for the Government of India. So actually it was Dr. Vijayathan who recognized Dr. Radhakrishnan's interest in research and provided invaluable guidance throughout his journey of studies on venous diseases. Experience in the field of management of chronic vascular diseases. So he has had a professional career spanning over 56 years and has focused on the management of venous diseases over the past 30 years. So today I will be sharing his key findings and innovative approaches in the management of CVD. So myself, I am Srikanth K, Research Scholar of School of Bioscience, Mahatma Gandhi University, Kerala. So about the professional background of Dr. Radhakrishnan, he is a senior consultant, vascular surgeon and medical administrator at the St. Thomas Hospital, Chettipuda in Kerala. And he is also the medical director of the St. Thomas Institute of Research on Venous Diseases. In addition, he is the founder of the Dr. N. Radhakrishnan International Center for Medical Innovation, Mahatma Gandhi University. So with that, we will start the presentation. So the cardiovascular system is the first system to develop during the embryogenesis, and by the 18th day of the gestation, the primary blood vessels begins to form from two endocardial tubes, and these arise from a vein bud, which is considered as the mother of the entire cardiovascular system. And these tubes actually later fuse to form the heart and further the cardiovascular system. So the total length of your blood vessels is actually 100,000 kilometers, and it can even circle the earth more than twice. So coming to the embryological considerations, so in this slide we can see the position of the fetus inside the womb, and at this stage of development, the heart effectively pumps blood throughout the body, reaching all vital organs and tissues. So now as we move on to the next slide, here you can see the positions of the babies as they begin walking in an upright position. So despite this change, the anatomical and physiological characteristics of the lower areas of the legs remain the same. So the reach of the heart pump actually extends only to the area just below the knee, and this anatomical limitation is crucial in understanding why CVD primarily affects regions beyond this point. And the blood flow dynamics in the lower extremities, particularly in the veins located in the legs and feet, make them especially vulnerable, as the venous system in these areas must work against the gravity. So these are the structure of both arteries and veins. So here you can see the significant difference in their composition. So the internal layer, the tunica media in the arteries, is much thicker and composed of primarily of smooth muscle cells and fibroblasts. And it also contains thick elastic fibers and collagen fibers. So veins have a unique structure that includes valves. So these valves play a crucial role in maintaining proper blood flow back to the heart. And these valves are especially important in lower extremities, where the blood must travel against the gravity. And vein valves are actually formed by the tunica intima, which is the innermost layer of the vein, and they consist of thin folds of endothelial tissue that project inward from the vessel wall. So the primary function of these vein valves is to prevent the backflow of the blood when blood is pumped through the veins, and particularly from the legs back to the heart. So this is the anatomical consideration relevant to the venous disease. So the type 1 veins, often referred to as the tributary collecting system, typically range from 0.02 mm to 2 mm in diameter, and these smaller veins are crucial for the collection of blood from capillary networks in the venous tissues and draining it into the larger veins. So the type 2 veins, also known as the trunk conducting system, have a diameter greater than 2 mm, and these larger veins actually serve as major conduits for blood returning to the heart from various regions of the body. So coming to the lymphovenous system. So the lymphatic vessels actually run parallel to the veins, and the lymphovenous system is an essential component of the circulatory system that includes lymphatic vessels, veins, and capillaries. So this system plays a crucial and critical role in maintaining fluid balance, transporting immune cells, and removing waste products from tissues. So the association between lymphatic vessels and venous system is particularly significant for understanding the pathophysiology of CVD. So this is the venous anatomy of the lower leg. So the venous anatomy of the lower leg is a complex one and essential for the effective return of the deoxygenated blood to the heart, and this system comprises various superficial and deep veins that work together to manage the blood flow against the force of gravity. So the heart is positioned actually approximately 1.5 meters above the ground level in the human body, and this anatomical positioning creates a significant challenge for the venous return in the lower limbs. And the negative pressure during the diastole is actually insufficient to facilitate effective blood flow from the lower extremities back to the heart. So this is an important question. Is varicose vein a disease? So actually varicose veins are commonly misunderstood as a disease. However, they are more accurately described as a physiological phenomenon that can occur in all veins. And varicosity refers to the dilation of veins only. And this condition does not actually indicate a pathological state, rather represents a common occurrence in the venous system as a response to pressure changes. So the term venous disease should be used more appropriately to refer to a pathological process. When venous disease involves the lymphatic system also, then it is referred to as a chronic venous disease. So coming to the CVD, that is chronic venous disease. So it includes conditions resulting from impaired venous function, primarily affecting the lower extremities. And among most significant forms of the CVD, they are chronic venous hypertension and chronic venous ulcers. So let us look onto the biophysics of the condition. So in a healthy person, the venous pressure is actually highest at the ankle, and usually it is more than 3 mm Hg in the superficial veins and 1 mm Hg in the deep veins. And this balance between the SVS and DVS actually allows for proper venous return from the high pressure gradient to a low pressure gradient, with valves functioning to prevent any backward flow. And our studies have shown that the patients with venous disease and the venous pressure actually can rise up to 60 mm Hg at the ankle level, 45 mm Hg at the knee level, and 30 mm Hg at the thigh level. So these valves are significantly higher. So these values are significantly higher than that of the healthy individuals, particularly in the superficial veins. So the issue is not that blood is flowing from the deep veins into the superficial veins. That is commonly referred to as the venous reflex due to any valve incompetence, such as failure of these perforators or something. So the common theory of venous reflex being the pathology of venous disease is a misconception. So there is another misconception, the egg chicken theory. So the pathology of venous disease is known as the egg chicken theory, where it is debated whether valve dysfunction or vein wall damage occurs first. So however, this concept is fundamentally wrong, and the true etiology actually lies in the the process of vein wall degradation, and it is actually very much evident. So the primary cause of venous disease is vein wall degradation, not any valve dysfunction. And actually there are proteins. These vein walls are rich in proteins which are elastins, collagens, and this is the actual problem, enzymatic dysregulation of vein wall. So to further understand the vein wall degradation, it's important to understand the role of extracellular matrix, that is the ECM, which is composed of collagen, proteoglycans, elastins, glycoproteins, and fibronectin also. So there are enzymes which are called as matrix metalloproteinases, and these enzymes are secreted by fibroblasts and smooth muscle cells, and they can degrade ECM proteins, allowing the vein wall to adapt and repair itself in response to any pathological changes. So this is the normal case. So when the activity of these enzymes is dysregulated, that is when the expression of TAMPs is more. It leads to vein wall degradation, affecting the elasticity of the vein wall, and thus causing dilation and hypertension in the veins. So the etiology of the venous disease involves genetic predispositions, and several genetic factors have been identified to date that contribute to the venous disease. So Dr. Radhakrishnan, in collaboration with research groups at the Rajiv Gandhi Center for Biotechnology, Trivandrum, Kerala, has made significant contributions in identifying these genetic factors that play a crucial role in venous disease. So one of the key findings from this collaborative research is the identification of mutations in the human forehead box-C2 gene, which is the FOXC2 gene, which are strongly associated with CVD and CVH, and this was published in 2015. So this is another work done as continuation to the previous publication. In this study, they could identify that the molecular alterations in DLL4 signaling are associated with smooth muscle cell hypertrophy and hyperplasia, which is associated with venous disease. So this finding further substantiated the significant role of altered FOXC2 DLL4 signaling in structural alterations of superficial veins, especially in the case of CVH patients. So coming to the pathophysiology of CVD, the increased venous pressure in the lower limbs initiates a cascade of cellular and metabolic changes, and the elevated venous pressure actually causes changes in shear stress, leading to the dilation of venules and capillaries. So with this, the capillary permeability increases and allows more fluid to accumulate in the surrounding tissue, resulting in increased interstitial fluid formation, and which leads to inflammation and pathological changes. So the progression of the CVD also involves a complex cellular and molecular mechanisms. The initial trigger in disease progression, which is the disruption of the normal blood flow, activates the endothelial cell lining of the vein walls. So this activation actually leads to increased endothelial permeability, allowing cell and proteins to leak into the surrounding tissue. So there are another important processes happening in the progression of the venous disease. So first one is the endothelial to mesenchymal transition, where endothelial cells acquire more mesenchymal migratory phenotype, allowing endothelial cells to lose their normal functions and cause pathological changes. And the other important process is the transition of smooth muscle cells from their normal contractile phenotype to a proliferative phenotype, contributing to vein wall remodeling and thickening. So this is a study done by the research team of Dr. Radhakrishnan, which demonstrated the occurrence of endothelial to mesenchymal transition, that is endemity, in venous diseases. So these are the key findings of that research. So now coming on to the importance of microscopic venous valves. So this is a research paper titled Valves in Small Veins and Venules by Dr. Alberto Caglietti, which gave a groundbreaking insight into the mechanisms of venous diseases by revealing the presence of valves in the microscopic venules and capillaries. So actually it was Caglietti's research which shifted the traditional understanding of venous anatomy by highlighting the microscopic venous valves and their potential role in the pathogenesis of CVD. So these are the electron microscopy images of microscopic veins and capillaries, which clearly show the presence of valves, which are presented in the article published by Dr. Alberto Cagliati. So then comes to coming to the relevance of microscopic veins. So traditionally it was widely believed that the large veins are primarily involved in the CVD pathology, while the small veins lesser than 2 mm in diameter are often regarded as the non-morbid and primarily responsible for only cosmetic issues. So contrary to that popular belief, CVD is not actually the result of issues within the larger veins. So instead it is due to the microcirculatory impediment, which is the failure of the smaller venules, capillaries and venules. So venules, which might be a new term to some of you. So the venules are the portion of the venules that have the same dimensions as capillary but are differentiated by the presence of microscopic valves. So this region is actually the most important area for the onset of the venous disease. And the incompetence of truncal veins alone does not actually cause any CVD pathology. So such incompetence of major veins along with the incompetence of microscopic veins increases the capillary venous pressure and thus lead to a tissue damage and thus progression to CVD. And also when the walls of the smaller veins are functioning properly, actually they prevent the increased pressure in the larger veins from being transmitted to the capillary level, and normally functioning valves in these tributaries allow the blood to be diverted through interconnecting channels into the deep vein system. So that's why when only the truncal veins are affected by incompetence, the patients do not develop any risk of CVD. And the symptoms of these venous disease do not manifest unless microscopic venous dysfunction is, occurs, except for complications such as bleeding and thrombophlebitis. So this is another common belief that the gravity of the chronic venous disease increases with age, and it is also a misleading one. So in our study, we found that patients in the early 20s suffering from a non-healing venous ulcers associated with CVD, and these young individuals presented with severe complications despite their age. So we also observed aged patients with numerous large veins visible throughout their lower limbs, but they did not show any severe complications expected in the CVD progression. So despite the presence of macroscopic venous dilations, these patients remained free of complications, which also suggested that actually macroscopic vein dilations, that is varicose veins, alone does not cause CVD. So the first image shows the healthy normal leg with veins functioning properly, and the second image shows that shows the large varicose veins in an elderly individual. So yet there are no signs of CVD. And the next two images shows the incompetence of smaller veins in the knee and thigh levels. So these conditions typically result in discomfort rather than severe venous disease. So lastly, the last image shows the reticular or spider wing-like structures in the angle region. So this is the condition where the greatest risk of CVD development occurs, which can further lead to development of chronic venous ulcers if not managed properly. So this is another research publication by Dr. Darshan titled Vein Size and Disease Severity in Chronic Venous Disease, in which he has discussed all these things. So in this study, these are the major findings. They could see a 4-fold increased risk of developing venous ulceration in patients who had incompetence primarily in the smaller veins. So these are the commonly used methods or techniques for the management of CVD. So these include the stripping of the major truncal veins, cryostripping, vena C, radiofrequency ablation, endovenous laser ablation, and clariving. So all of these procedures are done for the ablation of truncal veins, major tributaries, and valves located near the junctions and perforates. And these treatments do not address the incompetence of smaller veins, which we discussed earlier. So in all these methods, too much importance is given to the major valves in the perforators and junctions. So despite the fact that they do not have a direct connection to the smaller veins and capillaries, and any method of surgical block induced by any technique proximal to the tributaries will only be detrimental to the issues, provided the tributaries are also involved in the disease process. So this means that blocking the major veins without addressing the affected tributaries can actually worsen tissue damage and lead to venous dysfunction in very near future. So this is the root system of a plant with the electron microscopy image of a capillary blood network. So both the systems are share a similar structure, and the most important parts of the plant's root system that are the smaller and far-reaching roots, which are actually the most functional components which absorbs nutrients and thus maintaining the overall health. So if the disease affects the roots, the plant will be destroyed, and simply cutting the branches won't help to manage the disease. So in the context of CVD also, the smaller veins, virulets and venules, which like the smaller roots, are the more vital parts of the venous network. So focusing only on the larger veins without considering the dysfunction in the microscopic veins actually neglects the core problem, and thus can lead to the worsening of the disease. So actually we need to treat the cause with a physiological basis, as discussed in the previous slides. So for the treatment of CVD, we use a modified microform sclerotherapy, which is the new minimally invasive technique based on the knowledge of the microscopic veins and the microcirculatory impediment that they cause. So this innovative approach actually aims to prevent backflow towards the capillaries through the superficial venous system by effectively eliminating the problematic smaller veins, and at the tissue level using a suitable sclerosant, which is polydocanol. So treatment involves the systematic elimination of the superficial veins starting from the feet and moving up the leg by injecting microform polydocanol through small veins. So these are some details about the chemical that we use, polydocanol. It is actually a safe drug, and polydocanol is a liquid surfactant that, when infused into the vein, produces a selective endothelial property, and it exhibits a centrifugal retrograde distribution, flowing from larger veins to actually smaller ones, and ultimately reaching the smallest veins, which is actually needed in the actual treatment of CVD. So this is the microform polydocanol treatment. So the principle of surface tension is used in the method of microform sclerotherapy by mixing the surfactant polydocanol with water and gas to create a microform. And this is a research study conducted by Dr. Radhakrishnan on the effectiveness of modified microform sclerotherapy in a large cohort of more than 21,000 patients. So the study aimed to evaluate the novel treatment methods efficiency in managing CVD, and was able to confirm the positive outcomes associated with this approach. So here you can see the different stages of the efficient healing of the CDU on treatment with the modified microform sclerotherapy. So these are the surgical anatomy and preference of hierarchy of the veins that Dr. N. Radhakrishnan actually used for his treatment. So these images show the pre and post treatment effects of the modified microform sclerotherapy. So here in this image, after treatment, we can see the red colored regions on the leg, which indicates the removal of smaller veins also. So this is the procedure, that is how the treatment is done. So coming to the metabolism, so the polydocanol contacts the vein wall, and the chemical reaction occurs where the ether bonds break and alkyl chains undergoes some oxidation, leading to the activation of cellular mechanisms, which in turn causes inflammation and cell death. So this metabolic reaction actually results in formation of lower molecule PEG-like compounds, carbon dioxide and water. So these compounds are actually safely removed from the system within actually 1 week. So this graph shows the year-wise patient acceptance data collected in this study, so which evaluated the effectiveness of the modified microform sclerotherapy treatment, and this data spans from 1997 to July 2018. Here you can see the growing acceptance of this technique over years. So the steady increase in patient numbers highlights the effectiveness, safety, and positive outcomes of this treatment. So next, coming to the management of CVU, chronic venous ulcers. So in our treatment, it involves the steps to ensure proper healing. So first, the general condition of the patient must be improved, followed by controlling any infection present. So for that, we use treatments using honey. So coming to the topic, honey for CVU management. In our treatment, we use honey, and the honey has been recognized for its medicinal properties since the Vedic ages, and it is also noted for its healing properties in Ayurveda, Quran, and Bible, and also in a number of modern scientific reports, especially for treating chronic wounds. So honey promotes granulation and has a broad spectrum antimicrobial effects. So this is a book authored by Dr. Radhakrishnan titled A Treatise on Venous Diseases. This is another book authored by Dr. Radhakrishnan titled Genesis, Pathophysiology and Management of Venous and Lymphatic Disorders, published by Elsevier. So this book provides a comprehensive understanding of lymphovenous disorders for both medical students and professionals. So it covers the fundamental concepts of genesis and pathophysiology of these disorders while also discussing their clinical management. So the book serves as a guide for those who are looking to deepen their knowledge of venous and lymphatic disorders. So this is a review article authored by the team of Dr. N. Radhakrishnan. So Dr. N. Radhakrishnan has founded and established an institution with an advanced molecular biology research lab at the Mahatma Gandhi University, Kerala, dedicated to medical research, particularly focusing on venous diseases. So the institution is known as the Dr. N. Radhakrishnan International Center for Medical Innovation, which is led by distinguished team, including Dr. N. Radhakrishnan himself, Dr. Sabu Thomas, the former Vice Chancellor and Director of the Center for Nanoscience and Nanotechnology, and Dr. Radhakrishnan E.K., Associate Professor of the School of Biosciences and Director of the Business Innovation Incubation Center, Mahatma Gandhi University. So this is an advanced incubation facility we have set up at the Dr. N. Radhakrishnan International Center for Medical Innovation. So this state-of-art facility is dedicated to support innovative medical startups, providing them with the resources, mentorship, and infrastructure needed to develop healthcare solutions. So the incubation center actually serves as a hub for young entrepreneurs, researchers, and scientists to collaborate and translate their ideas into novel medical technologies. So these are various facilities established at the research lab of this NRICMI. So including the nested generation sequencing and cell culture facilities. So these are some of the innovative prototypes developed at the research lab for the management of chronic ulcers, including the nanotechnology-based synthetic enrichment formulations designed to enhance wound healing through targeted delivery and bioactivity, and also advanced hydrogel and aerogel-based matrices, which provide an optimal moist environment for wound healing, which can also promote the cellular regeneration. So these are some images of the patients which were managed by Dr. N. Radhakrishnan. These are congenital venous malformations. So with that, we will conclude the presentation. Thank you.